Now let's start with something most people completely overlook: swollen feet and ankles. A lot of folks think, oh, I was on my feet too long, or it's just age, or maybe I had too much salt. And yes, sometimes that's true. But if this swelling is persistent, if it keeps coming back, especially toward the end of the day, your body may be trying to tell you something much deeper is going on, specifically with your liver. Here's why this matters. Your liver is responsible for producing a critical protein called albumin. Albumin helps keep fluid inside your blood vessels where it belongs. When your liver is healthy, it maintains the right balance. But when the liver becomes stressed, inflamed, or fatty, albumin production drops. And when that happens, fluid starts leaking out of the blood vessels and settling into the lowest parts of the body. Gravity takes over, and that's why your feet and ankles are often the first place you see swelling. This isn't random, it's mechanical, it's physiological. Your feet are simply showing you what your liver can no longer manage efficiently. Now, let me make this very clear. This doesn't mean you suddenly have severe liver disease. That's not what I'm saying. What I am saying is that swelling can be an early warning sign that the liver is under strain. And early signs are a gift because your body is giving you a chance to fix the problem before it becomes serious. Another factor here is circulation. A congested liver slows down blood flow through the portal vein, which increases pressure in the vascular system. That pressure pushes fluid outward, and again, it pools in the feet. So if you're noticing tight shoes by evening, sock marks pressed into your ankles, or puffiness that doesn't go away overnight, that's not something to ignore. And here's where lifestyle really comes into play. Excess sugar, refined carbohydrates, alcohol, seed oils, and frequent snacking all put extra load on the liver. Over time, this leads to fatty liver, insulin resistance, and inflammation. The feet don't lie. They respond to that internal stress long before you feel pain or get abnormal lab results. What's interesting is that people often try to treat the symptom instead of the cause. They elevate their legs, reduce salt, or take diuretics. But if the liver isn't supported, the problem keeps coming back. You don't want to chase swelling. You want to remove the reason your body is holding on to fluid in the first place. The good news is this: the liver is incredibly resilient. When you reduce the burden, cutting sugar, cleaning up the diet, supporting bile flow, improving insulin sensitivity, the swelling often improves naturally. Not overnight, but steadily. And when that happens, it's not just your feet that feel better. Your energy improves, digestion improves, and inflammation throughout the body goes down. So when you look at your feet, don't just see swelling as a nuisance. See it as communication. Your body is saying, pay attention, something upstream needs support. And if you listen early, you can reverse the process before it ever becomes a diagnosis. Because when your liver struggles, your feet speak, and ignoring that message is the most expensive mistake you can make. Now let's talk about something that really catches people off guard: the sensation of burning, tingling, or unusually hot feet. A lot of people describe it as walking on warm sand, pins and needles, or a subtle electric feeling that shows up at night when they're trying to sleep. And usually, they're told it's just nerve issues, aging, or maybe circulation, but there's another major player that rarely gets mentioned, and that's the liver. Your liver is the body's main detox organ. Every day, it filters chemicals, hormones, medications, alcohol, and metabolic waste out of your bloodstream. When that system is working smoothly, toxins are neutralized and eliminated without you ever noticing. But when the liver becomes overloaded, usually from excess sugar, refined carbs, alcohol, frequent eating, or environmental chemicals, it starts falling behind. And when that happens, toxins don't just disappear, they circulate. Those circulating toxins irritate the nervous system. Nerves are extremely sensitive, especially the small peripheral nerves that extend all the way down into your feet. That's why the feet are often the first place where you feel nerve-related symptoms. Burning feet aren't random. They're a signal that the nervous system is under chemical stress and the liver is struggling to keep up. There's also a blood sugar component here that's impossible to ignore. When the liver is overloaded, it loses its ability to regulate glucose properly. Blood sugar swings, damage nerves over time, even before someone is officially labeled diabetic. That damage shows up as tingling, numbness, or heat in the feet. And again, the feet speak first because they're the farthest from the heart and the most vulnerable to metabolic stress. What's fascinating is that many people experiencing burning feet also report worse symptoms at night. That's not a coincidence. Nighttime is when the liver is supposed to be doing its deepest repair and detox work. If it's congested or inflamed, nerve irritation becomes more noticeable when the body slows down. The silence of the night makes the signal louder. Now here's where people get misled. They'll try creams, foot soaks, supplements for nerves or pain relievers, and sometimes those help temporarily. But if the liver remains overloaded, the symptoms persist. You can't calm irritated nerves long-term without addressing what's irritating them in the first place. When you reduce the toxic burden by cutting sugar, eliminating processed foods, reducing alcohol, spacing meals, and supporting bile flow, the liver regains its ability to clean the blood. As toxin levels drop, nerve irritation often settles down. It's not magic, it's chemistry, and it's one of the clearest examples of how internal health shows up externally. Another important point is vitamin storage. The liver stores critical nutrients like B12, which is essential for nerve health. When the liver is compromised, these reserves drop and nerves suffer. Burning feet, again, become the messenger. So if you've been dealing with hot, tingling, or burning feet and nothing seems to explain it, don't just chase the symptom. Ask the deeper question. What's overloading the liver? What's forcing the nervous system to send out distress signals? Because your body is always communicating. And when your feet start burning, it's not the problem, it's the warning. Listen to it early, fix the cause, and you won't just cool the feet. You'll restore balance where it actually matters. Now let's talk about something that can be subtle. But when you see it, it's incredibly revealing. Changes in the color of the skin on your feet. Maybe they look unusually pale. Maybe there's a faint yellow tint. Maybe the tone just looks dull, lifeless, or different from the rest of your body. Most people never connect this to internal health, but skin color is one of the clearest windows into what's happening with bile flow and liver function. Your liver produces bile for a very specific reason. Bile helps digest fats, but just as importantly, it's one of the main ways your body gets rid of waste products, especially bilirubin, which comes from the breakdown of old red blood cells. When bile is flowing properly, waste exits smoothly through the digestive tract. When bile backs up or becomes sluggish, those waste products don't leave efficiently. They stay in circulation, and when they stay in circulation, they show up in the skin. A yellowish tone, even a mild one, can be a sign that bilirubin is not being cleared properly. Now, this doesn't mean you suddenly have severe liver disease. What it means is that bile flow is compromised. The liver may be congested, fatty, inflamed, or simply overwhelmed. And because the feet are far from the heart and have slower circulation, discoloration often appears there first. Pale or washed out feet can signal a different issue: poor bile production and reduced nutrient absorption. Bile is essential for absorbing iron, copper, and fat-soluble vitamins. When those nutrients aren't absorbed, red blood cell quality suffers, circulation weakens, and skin tone fades. The feet lose their healthy color and warmth. They look tired because internally the system is tired. Here's another piece most people don't realize. Bile is alkaline. When bile flow slows, the body becomes more acidic. Acidic tissues don't heal well, don't circulate well, and don't oxygenate well. That shift affects skin tone, especially in the extremities. So discoloration isn't just about pigment, it's about chemistry. Now layer in diet. Excess sugar, refined carbs, alcohol, and seed oils thicken bile and slow its movement. Think of bile like dish soap. If it's thin and flowing, it cleans. If it's thick and stagnant, it clogs. When bile doesn't move, toxins don't leave, and the skin becomes the billboard for that backup. What's fascinating is how often people with bile flow issues also report light-colored stools, nausea after fatty meals, or discomfort on the right side under the ribs. These are not random symptoms. They're all part of the same story. The feet are simply giving you a visual summary, and once again, people chase the symptom. They look for creams, circulation boosters, or cosmetic solutions. But color comes from blood quality, nutrient absorption, and detox efficiency. You can't paint that on from the outside. When bile flow improves through dietary changes, reduced sugar, better fat choices, and less constant eating, the color of the skin often improves too. Warmth returns, tone evens out, the body starts moving waste the way it was designed to. And when that happens, the feet stop looking like a warning sign and start looking alive again. So don't ignore changes in foot color. They're not cosmetic flaws, they're metabolic clues. Because when bile stops flowing, the feet start showing, and color never lies. Now let's look at something that almost always gets dismissed as just a foot problem. Fungal infections, thickened toenails, recurring athlete's foot, or small cuts that take forever to heal. Most people treat these as hygiene issues or blame public showers, shoes, or genetics. But when these problems keep coming back or never fully resolve, there's usually a deeper issue at play. And once again, the liver is often at the center of it. Your liver is a major immune organ. It filters pathogens from the blood, helps regulate inflammation, and supports the production of immune factors that keep infections in check. When the liver is overloaded or inflamed, immune surveillance weakens. That doesn't mean your immune system shuts down. It means it becomes less efficient. Opportunistic organisms like fungi take advantage of that weakness, especially in areas with lower circulation like the feet. The feet are the perfect storm. They're warm, often enclosed in shoes and far from the heart. If immune strength is even slightly compromised, fungal organisms find an opening. That's why toenail fungus and recurring athlete's foot are so stubborn. They're not just surface infections, they're reflections of internal imbalance. Slow healing is another major clue. A healthy liver helps regulate blood clotting, tissue repair, and inflammation control. When liver function decline, wounds don't heal efficiently. Small cracks, blisters, or cuts on the feet linger far longer than they should. And the longer a wound stays open, the greater the chance of infection. There's also a blood sugar connection that can't be ignored. A stressed liver struggles to regulate glucose, leading to higher blood sugar levels. Elevated blood sugar feeds fungi and bacteria and damages small blood vessels. That combination reduces circulation and weakens immune response right where you need it most. The feet become a battleground. Your body can't quite win. Now here's where people get stuck. They'll use antifungal creams, sprays, powders, medicated polishes, sometimes for years. And while those can suppress symptoms, they rarely fix the problem. Why? Because you can't out-medicate a weakened immune system. Until the liver is supported, the terrain doesn't change and the fungi keep coming back. What's powerful is how quickly things can shift when the liver load is reduced. Cutting sugar, refined carbs, and alcohol removes the fuel fungi thrive on. Supporting bile flow improves nutrient absorption, especially zinc and vitamin A, both critical for immune defense and skin integrity. As the internal environment improves, the feet stop being such an easy target. And here's the encouraging part. Many people notice that once their liver health improves, infections become less frequent, nails begin to grow clearer, and wounds heal faster. Not because they fought harder on the surface, but because they restored balance internally. So if you've been battling stubborn foot infections or slow healing and nothing seems to work long term, stop blaming your shoes or your shower. Look deeper. Your body may be telling you that your immune system is struggling because your liver is overwhelmed. Because when immunity weakens, the feet reveal it, and healing always starts at the source. Now let's move to something that seems almost cosmetic at first. Cracked heels, rough skin, and feet that just won't stay smooth no matter how much lotion you use. Most people treat this as a skin problem. They file it down, apply thicker creams, maybe wear socks to bed and wonder why it keeps coming back. But the skin on your feet is often reflecting something much deeper, and once again, the liver is right at the center of it. Your liver plays a massive role in fat metabolism. It produces bile, which allows you to digest fats and absorb fat-soluble vitamins like A, D, E, and K. These nutrients are essential for healthy skin, proper cell turnover, and moisture balance. When bile flow is sluggish, or the liver is congested, those fats and vitamins don't get absorbed efficiently, even if you're eating a healthy diet. And the skin is one of the first tissues to show the consequences. The heels tell the story very clearly. They're thick, they bear constant pressure, and they rely heavily on proper fat content to stay flexible. When essential fats are lacking, the skin loses elasticity. It becomes dry, stiff, and eventually cracks. No amount of external moisturizer can fix an internal fat absorption problem. There's also a detox angle here that most people miss. Your skin is not just a covering, it's an elimination organ. When the liver is overwhelmed, the body tries to push toxins out through the skin. That disrupts normal skin renewal and damages the outer barrier. The residue, LT, thicken, flaky, rough skin, especially on the feet where circulation is already limited. Now add blood sugar into the mix. A struggling liver often goes hand in hand with insulin resistance. Elevated blood sugar stiffens collagen and reduces circulation to the skin. That means less oxygen, fewer nutrients, and slower healing. So those tiny cracks in your heels don't repair properly. They deepen, they split, and sometimes they even become painful or infected. What's interesting is that people with chronic dry, cracked feet often also have digestive symptoms, bloating, gallbladder issues, intolerance to fatty foods, or irregular bowel movements. These are all clues pointing back to poor bile production and liver stress. The feet are simply confirming what the digestive system has been trying to say. And here's where the frustration sets in. People keep treating the surface, pedicures, scrubs, medicated creams, but until bile flow improves, until the liver is supported, the skin keeps telling the same story. You're not deficient in lotion, you're deficient in internal support. When you start addressing the root cause, cleaning up the diet, reducing sugar, increasing healthy fats, supporting the gallbladder, and giving the liver a break, the skin responds. It doesn't happen overnight, but gradually the heels soften, cracks heal faster, the skin regains flexibility. That's not coincidence, that's physiology correcting itself. So the next time you look down at your feet and see dry, cracked heels, don't just see a skin issue, see it as feedback. Your body is telling you it's not absorbing what it needs, and the liver is asking for help. Because when fat metabolism breaks down, the feet show it, and smooth heels start on the inside, not the surface.